I am the youngest of 4 girls that were born into a family with one of the parents that was a diagnosed paranoid schizophrenic. I also have a husband that has chronic depression, and he deals with it on a daily basis, and some days are good and some days aren't.
So I had a pretty rough childhood full of alcohol, drugs, anger, confusion, violence, chaos, and lawlessness. There was no stability at all. I was homeless and hopeless.
I'm Donald Drinkard, and I am an instructor at the Tennessee College of Applied Technology. I'm over the Health Information Management and the Administrative Office Technology programs. My story is of addiction and poverty.
My name is Franklin Oldham. I have a doctorate in nursing practice, and I work for Henry County Medical Centers, Lake Haven.
My name is Allie Miller. I'm a master's in nursing. I'm a psychiatric nurse practitioner.
Hi, my name is David Johnson. I am a licensed marriage and family therapist and work at the Hometown Medical Clinic at the McKenzie location. I've been here for 10 years.
My gambling addiction is what really caused my poverty, and that's really a no-brainer. I had a friend that told me a couple of years ago that he was going to the casinos in Tunica for the weekend, and I told him, I said, well, the last time I went to Tunica, I stayed 8 years. And he laughed, and I said, I'm not joking. I stayed 8 years. I abandoned my job and just really everything. The last couple of years were really, I was ready for it to end, and I knew I was not strong enough to do it myself. I could see where I was headed, and I cried out to God for 2 years to please stop me. And through a series of events, He did. And I ended up here in Paris at the Damascus Road homeless shelter, destitute with very little more than the clothes that I was wearing.
I had an issue with severe depression several years ago, probably about 30 years ago or so, 35 years ago. And I was on medication, got better, stopped the medication, and then about 5 years ago, I realized that I was getting back into the cycle of the depression and the anxiety, not able to put one foot in front of the other, not wanting to eat, not wanting to get up and do anything. And there have been at points when, it's just like, I just don't want to continue any longer. And I knew it was time to start back on medication because there was no reason to be that miserable.
My family was good to me, but I was acting out and I was getting in trouble. I was drinking and using drugs in high school, and that continued well into my adulthood. I was living for my own pleasure, sarcastic, rude, and selfish. So selfish. I avoided true relationships. I was drinking way too much and way too often. I was sober for work, but I would take advantage of every excuse that I had to drink. I had a career and my life looked pretty good from the outside, but on the inside I was still unsure of who I was or how to deal with stress. To say my life was not going well at that time would be a massive understatement. My life was totally out of control, and I didn't understand why.
I did believe that God had somehow intervened, and not only did He put a stop to what I was doing, but He was going to give me another opportunity in life. And so the spiritual part is what I decided to take care of first. And somebody had told me about the Eastwood Church of Christ, and I wanted to be baptized, so I walked down Eastwood Street and went to the office. There was a very nice lady that was working in there that day, and she called one of the elders, and he came and talked to me for about 45 minutes, asked me a lot of questions, and then I was baptized, and that's my church family still today. Someone told me about the Tennessee Rehabilitation Center, so I made an appointment there, and I went, and they started me there in the workshop. It was not much money. It was production. But it was enough to move out of the homeless shelter and rent a room in a mobile home with a very sweet lady.
A good friend told me about a Christ-centered recovery program called Celebrate Recovery. This is designed to help people with all types of hurts, hang-ups, and habits. It sounded interesting to me, so in 2014 I went. I expected people to judge and talk, but they didn't. The people there were struggling with all types of life's issues, and they were all very welcoming. I kept going, and I began to engage, and I connected with people and formed important relationships for accountability and for mentoring.
Just realizing how bad I was in the past, and I knew that I wanted to put a stop to it, or at least get it under control before it advanced that far, and just knowing where I was at 30 years ago and knowing where I was heading at that point, and I didn't want to get there again. So I knew that when I started getting into that cycle again, that I needed to get help before it got worse.
So one thing that people don't realize is how much of an impact their mental health has on their physical health. And so people need to stop and think about the importance of their mental health, because their mental health has a direct impact upon their physical health, and actually vice versa too. So everyone needs to be attuned to what's kind of going on in their own head and paying attention to their feelings and changes in their moods or changes in the moods of people around them, if it's their children or if it's their loved ones or those kinds of situations, because they can impact every area of their life.
It's absolutely okay to talk about your feelings and what's going on in your mind. To come and ask for help is not weakness, it's strength. When your mind's out of control, it's a horrible place to be. You don't have to live like that. You just get some help.
Yeah, and when you come inpatient, it's not to come for weeks at a time anymore. You know, it's just a crisis. It's here to be a short little stay. A lot of times when you talk to your friends about mental health, or say, I've been having suicidal thoughts, or I can't cope anymore, you know, they have a very reactive action. You know, if you talk to Frank or I, you know, we do have non-judgmental thoughts.
Don't be afraid to reach out. I mean, I was in a desperate situation. I had to reach out. There's so many resources in this community. I did start with something that I felt like that I could get right by getting right with God. That was, to me, that was a measure of progress right there to start off with.
My life is now less chaotic, and my family's been restored. Not to say I've reached it, but I continue to push on, and I'm still working my recovery, and I'm excited about the future.
Don't let it get to the extent where you feel like there's no hope. There's no reason to be ashamed or embarrassed or hesitant to go to a doctor, go to a therapist, be on medication. There is absolutely no reason to be ashamed of that at all. If you would go to the doctor when you hurt your arm or when you had hypertension, you would go. And there's no reason to not consider that some kind of a mental illness, depression, anxiety, whatever, there's no reason not to consider that a physical issue also. I feel like I'm a productive member of society. I do good at my job, and I'm out there with the patients every day. And if they understood that I have that issue, and I am on medication, and I have been in therapy in the past, and I think I've done really well. And if they can see people that have had this issue and are functioning members of society, then that should be hopefully an incentive to get them to understand that.